My dream is that our country, and by extension Africa, achieves universal health coverage where nobody has to suffer catastrophic spendings when you go to access healthcare. I am Abdul Karim Ahiru. I'm a medical doctor, and I'm currently with the OPM RBF TA Fellowship as a full-time fellow.
The biggest success of the fellowship has been bringing people together who have a common understanding of the project so that we don't have diverse understanding on the field that can create a dichotomy in the implementation of the project.
Running a fellowship program like this, a one-year fellowship program that will put together both theoretical coursework and field application of the principles is so wonderful. So we have to design a curriculum that will take into consideration both the theoretical aspect of it, bring that inculcate into the fellows, and monitor and tutor the fellows on the field for field application.
All the 14 fellows, both in service and full-time, they have this common objective of serving the country for the development of health services, mostly in health financing, by saving lives at community level and at all the structured level of the health system in Nigeria.
An in-service fellow is one who is working with his organization. So for instance, I am already working with the State Primary Healthcare Development Agency. I don't have to take a leave of absence like the full-time fellows. So I work with my regular organization and then come for the learning blocks. And then during the field work experiences, I return back to my base. The fellowship exposes you to what is the best practice in terms of result-based financing. And then how can you contextualize what you are learning through the fellowship to impact on your people, creating in us champions for RBF. And we have seen out there in the field that the way to go for the Nigerian health system is actually through result-based financing.
I think in the fellowship we got exposed to very great materials, and we also got exposed to the highest level of expertise. We had consultants who were the very best at what they do internationally come and share their experiences with us, and we take learning points from there to implement while we carry out our activities. This for me is the greatest part of this fellowship program.
You see what is the best practice in class, and then you go to the field, you see what is actually happening currently on the field and what are the learning points, looking at the best practice and see how we can correct some of these deficiencies that we see in the field.
The result-based technical assistance has been on in Nigeria for the past 4 years. And we thought a better way to build local capacities could be through a fellowship program where we can kind of transfer competencies in the classroom environment. And we have fellows who are being trained to become TAs that can easily take up the positions of technical assistants in the various states, the project implementing states and the pilot states and the scale-up states, because as we have 5 new states coming into the project.
We think that the fellowship will go a long way to capacitate the healthcare providers so that they'll be able to provide better quality of care to the end users, to the mothers, especially the children.
RBF has helped to improve in engaging people to work, that is engaging manpower. The qualified midwife is there to attend to them. They don't waste time. We attend to them on time so that they go back. These are what we have seen in the antenatal care, and to crown it all, deliver a successful, a live-bound baby. That's what we have seen. There really arose community interest to participate fully in the activities of the primary care. The number of the antenatal people we used to see have improved. The drugs is also available for our women.
The PBF has really helped us a lot, especially using of pathograph, which we are not using before. Now we go through pathograph, they come different times to check our pathograph, to put us through the new things. We go through, we make use of the pathograph, and then we also ensure that all women deliver safe and sound, because through the pathograph we'll be able to know if it's something that we can handle or if something that we cannot handle, we transfer them to the next system, that's the secondary system. We transfer them there and we make sure that we follow them up to make sure that the referral will get back the feedback from the hospitals that we send them to.
During delivery, the price is not high, it's affordable. So we love the place.
Through this project, the poor have been able to have access to health care. And I think this is a way forward to reaching universal health coverage, where people should not die because they don't have access to health care services.
In Nigeria, there's certainly going to be a ripple effect because these guys are going to be able to transfer competence to other Nigerian experts. So we are sure that they are going to influence that general scale-up and continuous capacity building to other Nigerian experts.
I believe at the end of this fellowship we would have 14 capable individuals internationally who would hold their own at any time and place and also be able to deliver high-impact services or technical support.
In 3 words, I would describe the fellowship as efficient, innovative, and effective.
Quality, theoretical, and practical training.
It's timely because it's what we actually need as a country. The Nigerian health system needs people that can advocate for result-based financing.
The effectiveness of this fellowship is that we have a limited number of people trained in a limited time to maximize resources and to get the well-trained people.